Well, hey guys, in today's video, we're going to be talking about skin signs you are vitamin deficient. Specifically, we're going to be focusing in on B vitamins for which there are skin manifestations of deficiency states. First of all, vitamin B2, otherwise known as riboflavin. Mammals, including humans, don't possess the ability to make riboflavin on their own. You have to get it from your diet. Not a problem. It's widely available in a wide array of different types of foods. Meats, cheese, eggs, legumes, vegetables, and many of our foods are fortified with this vitamin. Riboflavin is essential for growth and development. It's vital for the function of the cells in your body. Who is at risk for riboflavin deficiency? Breastfed infants of mothers who are riboflavin deficient, individuals who suffer from alcohol use disorder, and those who have had bariatric surgery. You also can see riboflavin deficiency in people who have profound hypothyroidism. Newborn babies who undergo phototherapy for the treatment of high bilirubin, hyperbilirubinemia. Basically, elevated levels of bilirubin in a newborn baby can be quite damaging to them. And to treat this, they are exposed to blue light. It degrades the bilirubin, but it also degrades riboflavin. And if not executed properly and monitored, they're at risk for riboflavin deficiency. Fun fact, beer is actually pretty high in riboflavin. But the reason that beer is sold in opaque bottles is because the riboflavin is photosensitive, and actually different hops in the beer degrade, they become sensitized by degraded riboflavin, and that's what gives beer that skunky taste when it has gone off. Riboflavin deficiency can be caused by medications. The chemotherapy doxorubicin is known to put patients at risk for riboflavin deficiency. You also can get low levels of riboflavin as a result of tricyclic antidepressants. These include imipramine, desimipramine, amitriptyline, and nortriptyline. The medication Thorazine can impact riboflavin levels. The gout medication probenecid can lead to a decrease in absorption of riboflavin in the gut, and it also can increase excretion of riboflavin in the urine, ultimately putting patients at risk for B2 deficiency. And thiazide diuretics. These are used to treat blood pressure. You've probably heard of the medication hydrochlorothiazide. Well, they can increase the excretion of riboflavin and potentially put people at risk for B2 deficiency. What are the dermatologic findings of this vitamin deficiency? The oral oculogenital syndrome, because it involves the eyes, it involves the mouth, and it involves the skin of the genitals. Oral manifestations of vitamin B2 deficiency include very chapped lips and inflammation at the corners of the lips known as angular cheilitis. Individuals with riboflavin deficiency can have these red, painful, raised bumps at the corners of their mouth. When you look inside the mouth, the tongue can become quite swollen. Initially, the tongue has very prominent appearing taste buds and it has a cobblestone-like appearance, but as the riboflavin deficiency persists a bit, the tongue becomes very smooth, very shiny, and magenta red, and almost beefy appearing. Those red raised bumps at the corners of the mouth can bleed easily and again be very uncomfortable. With riboflavin deficiency, you will often develop a conjunctivitis. That's basically inflammation of the conjunctiva of the eye. Along with that, you can be very sensitive to light. This is known as photophobia. So what exactly does the genital involvement entail? This is most striking in men, and it presents with a prominent rash involving the scrotum. Interestingly enough, the rash tends to spare the midline of the scrotum, and with time it ends up often spilling on over to involve the inner thighs, and it can even involve the skin around the anus. Initially, the rash is very itchy, but as it persists, it becomes cracked and very painful, and the skin can become swollen. While it's uncommon to involve the genitals in women with riboflavin deficiency, in some cases you can see a prominent vulvar dermatitis as well. In addition to the oral oculogenital syndrome, you also can have a pretty striking facial rash that looks like pretty intense seborrheic dermatitis. It's described as a seborrheic dermatitis-like rash. What is seborrheic dermatitis? It's a common skin condition that involves flaky, red, greasy patches, often in the nasolabial folds, the forehead, in the eyebrow area. It also can involve the skin behind the ears, and you can see this in riboflavin deficiency. In newborns who have riboflavin deficiency, this type of rash will interestingly often present in the skin folds in the diaper area. Moving on, the term niacin denotes nicotinic acid, but it's also used to name a group of related chemicals, namely nicotinamide and related compounds like nicotinamide riboside. As a side note, on this channel I have 2 videos on supplements in this family. One of them is niacinamide, which I have a video talking about this dietary supplement specifically for skin cancer prevention. So I will link that in the description box. Check it out if you are interested. And I also have a recent video talking about the popular anti-aging dietary supplement NMN. So definitely check that out if that is of interest to you. Excluding cats, most mammals, including humans, have the ability to make niacin to a certain extent from the amino acid tryptophan. And suffice it to say, the majority of our niacin needs are not coming from tryptophan because tryptophan primarily is utilized for protein synthesis. Therefore, niacin is mostly coming from our diet. It's absorbed in the small intestine, though a small amount is also absorbed in our stomach. Niacin and related chemicals are essential for the formation of something called NAD. NAD is vital for metabolism and energy in the cells in our body. Niacin deficiency, first described in 1773, known as pellagra. We learn about the signs of niacin deficiency of pellagra as the 4 Ds. Stands for diarrhea, dementia, dermatitis, and if left untreated, death. Who is at risk for niacin deficiency? 35% of cases of niacin deficiency are related to alcoholism. 26% of cases are related to medications. 16% have to do with insufficient intake through your diet, whereas 13% have to do with a problem with absorption. The dermatitis of pellagra is noteworthy. It is photodistributed, meaning only in areas where the sun shines. Initially, they develop a rash in sun-exposed areas that's painful, red. For all intents and purposes, it looks like a sunburn. But as the deficiency persists, that rash can evolve to form little tiny blisters and larger blisters. This stage is known as a wet pellagra. With repeated sun exposure in the setting of niacin deficiency, patients develop persistent hyperpigmentation with recurrent eruptions, most notably on the backs of the hands, but really anywhere where you have sun exposure. It also can involve the face. One classic finding with the dermatitis of niacin deficiency is referred to as Casale's necklace. Thickened, dark discoloration in sun-exposed areas of the sides of the neck and the upper chest. This thick band of discoloration and dermatitis in a necklace-like distribution. You can develop painful sores that involve the genital area or the skin between the genitals and the anus, that's referred to as the perineum. Like with other B vitamin deficiencies, it's not uncommon to develop a painful glossitis, otherwise known as inflammation of the tongue. Patients with niacin deficiency also can have profoundly chapped lips, and they often develop hyperpigmentation over bony prominences like the elbows and the knees. The sebaceous glands can become quite prominent, giving the appearance of a seborrheic dermatitis-like picture. Again, that's that facial rash that happens around the nose, in the eyebrows, on the forehead. Briefly, I want to talk about vitamin B5, otherwise known as pantothenic acid. Vitamin B5 comes from our food. Humans cannot make it themselves. But don't worry, it's widely available in most foods, and it's pretty hard to become deficient unless you have some sort of malabsorption problem or you're simply not eating a proper diet. Vitamin B5 can be found in meat, eggs, fish, legumes, whole grains, vegetables. Like I said, it's pretty difficult to become deficient if you are eating food. Vitamin B5 plays a critical role in the synthesis of coenzyme A and something known as acyl carrier protein. protein. Acyl carrier protein is essential for fatty acid synthesis. Coenzyme A also is vital for fatty acid synthesis as well as metabolism. It's essential for synthesizing cholesterol, a neurotransmitter known as acetylcholine, and for making bile acids. The thing about vitamin B5 deficiency is it's actually kind of hard to nail down what exactly the findings are, because it's not only is it rare, but it's rare for it to occur in isolation. Most cases, and this goes across the board with really any vitamin deficiency, it's pretty rare to have an isolated vitamin deficiency, especially an isolated B vitamin deficiency. They often go hand in hand, so you will have a lot of overlap. For that reason, there's not necessarily a specific skin finding of B5 deficiency. Now, as a reminder, I do have a video all about pantothenic acid supplementation for acne. Long story short, there is insufficient data to recommend pantothenic acid as a treatment for acne, but it is popular on social media. People hype it up all the time. So check that video out if you want more info on the research that we have about that. Now, what about putting it on the skin? You see it all the time in skincare products. I often point it out in some of my favorite skincare products because it's an ingredient in moisturizing products I really like. It's effective, but its efficacy has nothing to do with the fact that it's a vitamin. It's simply hygroscopic, meaning it happens to be keen for attracting water, and therefore it's a great moisturizing ingredient. It's helpful for dry skin conditions. It has nothing to do with it being a vitamin. It's just a hygroscopic. And in ingredients, you'll see it often labeled as dexapanthenol or D-panthenol. Moving on, vitamin B6, otherwise known as pyridoxine. Pyridoxine is a cofactor for over 1,000 different enzymes in your body, so to say that you can get along without it is a no-go. You absolutely need it, and it's one of those things you have to get from food. You don't make it yourself. It comes from meat, legumes, whole grains, nuts, seeds. Not only is it a cofactor for a variety of different enzymes that are necessary for amino acid, lipid, and protein synthesis, but it's also vital for producing hemoglobin, and it's critical for brain development. It's also vital for immune function. Who is at risk for pyridoxine deficiency? Those with chronic alcohol dependence. I pointed this out in other videos where we're talking about nutrition, but alcoholism often leads to nutrient deficiencies because the individual becomes so dependent on alcohol that they stop eating food. And so they essentially are not taking in nutrients, and they develop a variety of deadly vitamin and micronutrient deficiencies. Certain malabsorption states can lead to low or insufficient vitamin B6, namely inflammatory bowel diseases like Crohn's disease, because the inflammation in the gut is interfering with proper absorption. Likewise, individuals who have undergone bariatric surgery, they are an at-risk group for a variety of vitamin, mineral, micronutrient deficiencies, including pyridoxine. Because of increased demands, pregnancy is a situation where you may be at greater risk for pyridoxine deficiency. People who have certain autoimmune diseases, especially rheumatoid arthritis, they have increased demands for vitamin B6, and therefore, if they're not changing up their diet or supplementing as may be necessary, they are at risk for deficiency. And individuals who are on dialysis for chronic renal failure, kidney disease. If you are on dialysis, you are an at-risk group as well, likely due to increased demands for B6. Certain medications can definitely interfere with B6 levels, namely a medication called isoniazid. We use this to treat tuberculosis, and it can lead to B6 deficiency, so that's something that needs to be addressed as part of treating tuberculosis. The Parkinson's medication, levodopa, likewise can cause B6 deficiency, as can certain medications used to treat seizures. The human body does not store vitamin B6. It's absorbed in the small intestine, and excess amounts are excreted in the urine. But if you are deficient, what does that look like for your skin? Again, this is another one of those B vitamins where for whatever reason, you end up with seborrheic dermatitis. Inflammation, mostly on the face, around the nose, in the eyebrows, on the forehead, and it's pretty intense. Probably has something to do with immune dysregulation secondary to vitamin deficiency. These B vitamins, they're really important for proper immune function. And when the immune system is weakened and down secondary to a vitamin deficiency, well, you're more prone to inflammatory skin issues. In the case of B6 deficiency, for whatever reason, the seborrheic dermatitis often involves the neck, the back, the shoulders, so it's more widespread. And last but certainly not least, let's remind ourselves about the skin findings of vitamin B12 deficiency, otherwise known as cobalamin vitamin B12. As a side note, I say let's remind ourselves because I have a whole dedicated video on the skin signs of vitamin B12 deficiency, which I'm going to link in the description box. Definitely check it out. B12, vitamin B12 is vital for making DNA. So it's essential for cellular division. I mean, it's really important. It's key for energy production. It's vital for your nervous system, including your brain, to function properly. Unlike vitamin B6, your body does store B12 quite well. As a matter of fact, in the setting of inadequate intake, vitamin B12 deficiency won't appear until 2 or 4 years down the road. Who is at risk for B12 deficiency? Individuals following a vegan diet who do not supplement their diet with B12. Now, there's an autoimmune condition called pernicious anemia. This is actually the most common cause of B12 deficiency in the UK. Pernicious anemia is an autoimmune attack against certain cells in the stomach. And these cells make something called intrinsic factor. Intrinsic factor is essential for absorbing vitamin B12. So the immune system of these patients attacks a certain population of cells so they can't properly make intrinsic factor to absorb their B12. Then anybody who has had part of their stomach removed, gastrectomy surgery, say for an ulcer, puts you at risk because those cells there, depending on the location, they're the ones making that intrinsic factor. And of course, individuals with Crohn's disease and inflammatory bowel disease, they likewise can develop B12 deficiency because B12 is absorbed in the small intestine. Did you know that the medication metformin can put you at risk for B12 deficiency? And it's been pointed out that people on metformin long term, they should be monitored for lowering of their B12 and supplemented accordingly. Likewise, a class of medications known as proton pump inhibitors, things like omeprazole, used to treat gastric reflux disease. By lowering the acid in your stomach, they inhibit the release of B12 from your foods and things. So that's another risk factor. What are the signs of B12 deficiency? B12 deficiency presents with the triad of anemia, neuropsychiatric symptoms, because again, B12 is vital for your nervous system, as well as glossitis, aka inflammation of the tongue. With B12 deficiency, like some other B vitamin deficiencies, you get inflammation of the tongue, and basically the taste buds, they atrophy, so the surface of the tongue looks smooth, bright red, it's painful, it burns. You can see this though, as I pointed out, in other B vitamin deficiencies. Probably more specific for B12 deficiency is going to be these prominent linear depressions inside the mouth on the hard surfaces of the mouth. This might actually precede the development of the anemia. So it's a clue, and if recognized early and intervened, could potentially be very life-saving. Because of the involvement of the tongue with atrophy of the taste buds, you can have loss of taste, dysgeusia. And similar to other B vitamin deficiencies, you can get involvement of the corners of your mouth with painful cracks. That's known as angular cheilitis. Another characteristic finding of B12 deficiency is hyperpigmentation, especially hyperpigmentation that involves the creases of the palms, as well as the skin folds like on the arms and behind the knees. You can also get hyperpigmentation involving the face, and you can get hyperpigmentation in your nails. You can get these longitudinal dark streaks on the nails with B12 deficiency. Lastly, you can get hypopigmentation of the hair. You can get loss of pigment in the hair, premature graying of the hair. Unlike graying of the hair as it relates to normal aging, when you get premature graying of the hair secondary to B12 deficiency, once the B12 deficiency is corrected with supplementation, then the hair color will go back to normal. often that can happen. But don't just take a bunch of B12 vitamins because you are starting to go gray. In the absence of B12 deficiency, doing that is not going to do anything but likely make your urine expensive. And a lot of people, as a side note, do report that they get acne-like breakouts with high levels of B12 supplementation. In the absence of deficiency, whether or not these types of B vitamins are essential for you, discuss that with your doctor for sure. That way you don't go out and waste your money on unnecessary supplements. If you follow a vegan diet like myself, then yeah, you absolutely need to take B12. But definitely discuss with your doctor or a registered dietitian if you are following any specific type of diet where supplementation may actually be necessary, or if you have an underlying medical condition like inflammatory bowel disease, that makes absorption of these things problematic for you, definitely talk to your doctor or a registered dietitian who is familiar with managing dietary needs of patients that have inflammatory bowel disease. Likewise, if you have had gastric bypass surgery, weight loss surgery, or if you have had a gastrectomy for other things, or definitely make sure that you are following up appropriately and having blood levels of these things monitored if necessary. Follow under the care of your doctor. All right, y'all, that's a wrap up here. In the description box, I'm going to link my video on the skin signs of B12 where I go more into detail there, but I hope you all enjoyed this video. If so, give it a thumbs up, share it with your friends, and as always, don't forget, sunscreen and subscribe. I'll talk to you guys tomorrow. Bye.